Hi, I'm Paul Sponseller. I'm a spine surgeon and head of children's orthopedics here at Johns Hopkins. I have been doing this for 35 years. I started back in 1986 at Johns Hopkins. I really enjoy taking care of kids and helping with the most challenging problems that they have, often involving a curve of the spine, such as scoliosis or kyphosis. I've just always been intrigued by the seriousness of spine curvature and how it can affect a child's life, and felt a lot of satisfaction from being able to straighten it out. One of my friends says it's the best job in the world if you can straighten out teenagers. I am from the Midwest originally. I did my medical school and undergraduate at the University of Michigan. I spent 5 years of orthopedic residency at the University of Wisconsin in Madison. I did my fellowship at Harvard at Children's Hospital Medical Center in Boston, and then I joined Johns Hopkins in 1986. Our goal is to be able to prevent the need for surgery whenever possible. So the exciting developments have been further proof that bracing can work, better designs of bracing, easier ways of making the brace so the child can wear it comfortably. And we are trying to improve the chances of brace by an additional method that we are about to study, which is called the use of disport in the muscles that are tightest in the spine. Families come with different degrees of education and expectations. Some of them are afraid from the moment they come in that they're going to need surgery. That's not usually true. So we usually discuss the appropriate role of bracing to prevent surgery, which usually it can do. Unfortunately, bracing sometimes doesn't work, and that's where we hope this trial will play a role, improving the success of bracing so the vast majority of time that they wear it, that it will prevent the surgery. Additional new developments include the low-dose method of doing an X-ray called EOS, which is 1/10 the dose of a normal X-ray, and that's something that's come about in the last 5 years in the US at least. And so that reduces the radiation that children need from their scoliosis X-rays several times per year. Now that we've found that bracing is important, we also use an I button, which is a timing device that feeds back information to the patient about how well they're doing with meeting the goal of wearing the brace. We'd like them to wear it 23 hours a day, 22 hours a day, something like that. Most people think they're doing it, but they really don't know, and many times they overestimate how well they're doing. So the I button feeds back that information so patients can try to improve their use of the brace and therefore their results. I really like working with the National Scoliosis Center because they focus only on scoliosis. They don't do other kinds of bracing, so they are the most specialized group of orthotists that you would find anywhere. And they use the most modern technology to make the braces. They work with the patients so that they're comfortable, do everything possible to get the wearing pattern and wearing goals met. And I think the results are as good as you could possibly get. I find that many patients put 110% of trust in us, and we try to meet that. They also are very good at meeting this challenge of being a teenager, developing your personality, going through school while still wearing a brace, and dealing with parents in that process. So many kids are very good at navigating all those things, and I find that really inspirational because it is hard doing them all at once.